I could have gone to the US, you know. I passed naman lahat ng exams. But then, it was like a bandwagon. Exam lang tayo ng exam. But I never really thought of going abroad permanently. Because I saw lots of patients. That time, maski 30 years ago, parami ng parami ang pasyente who have kidney problem. And maybe that's why National Kidney Foundation of the Philippines was built, because of the need to take care of this illness. Although I was enticed to be in a private hospital as full-time, I declined because I wanted to stay here at NKTI. I am Dr. Rosete Liquete. I am currently the Executive Director of the National Kidney and Transplant Institute. I am the first woman transplant surgeon in the Philippines. And as such, I have helped push the frontier of organ transplant in the Philippines for more than 30 years, actually going on 35 years now. As a transplant surgeon dito sa Pilipinas, we have helped a lot of patients who are on dialysis and increased their number of dialysis for the year. It's more of advocacy to promote deceased organ donation, wherein you can ask the family to donate their organs, because a lot of patients are waiting for organs for their transplantation. Worldwide, there is shortage in organs, and that's why we campaign for deceased organ donation also. We have to help other centers build their own transplant program. One way is that to capacitate them and train nephrologists, transplant surgeons, anesthesiologists, urologists who can go back to the provinces so that we can have centers. So they need not come to Manila for transplant. What inspired me or so, transplant is the ultimate treatment if you have end-stage renal disease or liver disease or liver transplant. Yon. It's a miracle indeed. It's like a rebirth for these patients. I have a story of a patient who had 3 transplants when he was a teenager with a mother as the donor. And then, of course, through the years, you can have rejection through the years. It's not always forever. Meron ding time na you can have rejection. And then he had rejection when he was like 20s already. The second donor was non-related, and then also this kidney was rejected. This is giving hope also to other patients that even if you reject, you can have the chance to have transplant again. And then the third transplant I did in 1996. The other December, he succumbed not because of rejection, but because of problems of the heart. You see, this patient lived for so many years. Since 1996, after the third transplant, that was the longest time. Kidney patients not only have kidney problem, eventually they can succumb to heart problem and to uncontrolled diabetes. Yung pinaka-challenge namin at the time was really a challenge also for NKTI when we had this legal battle the doctors of NKTI and myself as the surgeon were charged with a murder for a patient who had gone brain dead and then transferred to NKTI. We exerted effort to look for the relatives, but we cannot. There is a presidential decree even before, during the time of President Marcos, that the hospital may authorize getting of the organs for transplantation. So that's what the hospital did, as authorized by the director. But when the families surfaced, sabi nila, we made the patient brain dead so that we can get the organs. Most of the people in the early 1990s, 94, did not understand what brain dead is. So there was a law that was passed, the Public Act 7170, and it defined brain dead as dead. So you can get the organs even if there are no relatives, as long as you have exerted a lot of effort to find it. The case was closed. In the past 5 years that I have been a director, marami kaming challenges, of the leptospirosis, no? Yan ang mga natural challenges namin. We have this water crisis in 2018, and of course, this COVID pandemic. It's now the 3rd year of the COVID pandemic, and still it is a challenge to every one of us. How to take care of our patients, our health worker. During this recent lamang na surge natin, we have more than 800 healthcare workers who turned out positive. In the past year, 500 lang, 600. But of course, because of the vaccination, the cases this year had been more mild or even asymptomatic at all. The challenge for our patients is that they kept on coming to NKTI, especially dialysis patients, because they were refused by other dialysis centers. We have limited space at the hospital, and we don't want to infect our non-COVID patients, that we have to build our own COVID field. We had mga tent, like a tent city. It's for the accommodation of COVID patients, so we can cohort them. And then may satellite operating room din kami para sa COVID patients. May satellite radiology area kami para they don't mix at all, kasi it's not good for our patients who are immunocompromised. As a director of this institute, more important accomplishment is that we were able to get the lot, which used to be occupied by illegal settlers, 5,000 square meters. And during the COVID times, we used this area to build the modular dialysis facility, mainly for patients who had COVID and had their dialysis. We have 3 more buildings to build. I hope we can finish that in 1 or 2 years to improve our service to patients, especially those with renal problems. All these challenges, we were able to face them squarely. So of course, it was a feather in the cap of my leadership as the executive director. I'm happy because our employees were able to surpass this one also, and we call them heroes. The past 2-3 years, despite this pandemic, we were able to have international and local recognition. For example, with the Healthcare Asia. Last year, KTI is the specialty center of Asia, given by Healthcare Asia. We were recognized by the International Health Federation in Switzerland. And above all, we still continued with our performance systems to improve the systems in the hospital. That's why we were able to get UV Rhineland ISO accreditation and the performance governance system. And we will be awarded soon by the Philippine Quality Award. That I will be awarded by the President himself if there will be no problems with the COVID anymore. There is the universal healthcare, and I am with the TWG on the framing of this stratified framework for the renal health. Even if I will not be a director anymore in the future, I want to help continue with this project because in this stratified framework, you start with the barangay to train people there, to make aware the population of how to take care of their kidneys. And then when you have problems with your kidneys, I hope with this UHC, hindi na maraming tao magkakaroon ng renal failure kasi you can take care of them even at the barangay level pa lang, at the barrio level. Hopefully wala nang magpapatransplant because we will educate the people. As an awardee, it further widened my horizon. Marami tayong namang kababayan na nandiyan na may very exceptional na nagsiserve sa community. Not only kami mga doktor, marami pa dyan. Kung makita ko nga na iba-ibang sektor ng gobyerno ang napagbigyan ng pagkikilala o napahalagahan, na-realize ko na hindi lang kami mga doktor ang dapat na nandito sa Honors Award na ito. Marami pa. I hope kung sino man ang nakikinig sa ibang sektor ng gobyerno na meron kayong exceptional na kontribusyon sa inyong trabaho, sana naman ay makita rin at mabigyan din kayo ng chance na magkaroon ng award na ito. Sa atin pong mga kababayan, ang Civil Service Commission po ay merong Honors Award Program upang ipakilala sa buong bansa, ang marahil sa buong mundo, na tayo ay may mga kababayan na very exceptional sa kanilang contribution para sa ating bansa. Hindi lamang sa larangan namin mga doktor, hindi sa ibang sektor ng gobyerno. Meron po kayong kilalang mamamayan na mahalaga ang kontribusyon sa ating bayan, kinominate po natin sa ating Civil Service Commission at nang sila ay makilala at mabigyan ng pag-asa manalo din po sa Lingkod Bayan.